lottery or your disability actually literally got medically better, you would not be eligible for 1619B. But if the only reason your SSI stopped was because your earnings were high enough, but they weren't over the threshold amount, then you'd still be eligible for 1619B. Really tremendous work incentive. The man who actually wrote 1619B, that rule, when he was the head staffer of the House Ways and Means Committee back in the 80s, a man named Alan Jensen, later became an academic at George Washington University, and I knew him. And I once attended a national conference, and I was chatting with Alan, and a young woman came up to him and kind of shyly asked, "Excuse me, are you Alan Jensen?" And he said, "Yes, I am." And she asked him, "Did you write the 1619B rule?" And he said, "Yes, I did." She held out her program and asked, "Could I have your autograph? Because it really is that good." So this 1619B rule really means that people have nothing to fear, even if they earn enough to reduce their SSI to 0. Okay, I'm going to skip the 4th and 5th safety nets because they're really rarely going to be applicable. Usually the 1619B rule is as far as you need to go with safety nets. But I did want to tell you about how to get free help to use work incentives from nationally certified experts. You can call the Ticket to Work helpline at 866-968-7842. Explain that your son or your daughter is getting SSI or Social Security disability, is working or trying to work, and they will refer you to a project called Maryland Work Incentives Network that will give you free benefits counseling to understand the impact of earnings or various earnings levels on your son's or daughter's benefits, and to help them use work incentives. If your son or daughter is getting services from DOORS, the Maryland Division of Rehabilitation Services, DOORS is required to pay for benefits counseling if your son or daughter gets SSI or Social Security disability. So, and they're also provided by nationally certified benefits counselors. And if you'd like to apply for services from DOORS, there's a link on this slide that can let you find the nearest DOORS office. If your son or daughter is still in high school and in special education or has a Section 504 plan, they'll most likely get assistance applying to DOORS through school. And wanted to talk about Social Security disability a little. And then the remaining time, I'm going to go ahead and answer as many questions as I can. So up until now, we've focused entirely on SSI and medical assistance, also known as Medicaid. What and social
Michael, we're losing you.
If you're disabled or you can find, oh, sorry. Okay, let's try that again. So remember, SSI you get if you have a disability or you're at least 65 and you have limited finances, low income and resources. Social Security disability you get if you have a disability. The disability definition is exactly the same as for SSI. But in order to get Social Security disability, either the person with a disability or a parent or a deceased spouse has to have worked and paid Social Security taxes on their earnings. When you pay Social Security taxes on your earnings, that's like paying your insurance premiums. So Social Security disability is an insurance program. It's based on having worked and paid Social Security taxes on earnings. There's no limit on assets, on resources for Social Security disability, and there's no restriction on any kind of income, with two exceptions. There's a limit on how much you can earn, and if you get workers' compensation, that would reduce the amount of your Social Security disability. There are two kinds of Social Security disability that your sons or daughters could potentially be eligible for. The first is usually referred to as Social Security Disability Insurance, SSDI. That's a benefit that they can get if they, your son or daughter, have worked and paid Social Security taxes long enough on their earnings to qualify. Now, older adults, those over age 30, generally have to have worked 5 out of the last 10 years and paid Social Security taxes on their earnings to be eligible for SSDI. But people under 30 don't have to have worked as long. In fact, people under age 24 could qualify for SSDI with as little as about 18 months of work. So in some cases, you might have a son or daughter who starts out on SSI, goes to work, and then gets switched to Social Security Disability Insurance, SSDI. Oftentimes, the SSDI benefit is greater than the maximum SSI benefit. In which case, obviously, they'd come out ahead. Other times, the SSDI benefit may be low enough that your son or daughter could still get a little bit of SSI in addition. The second kind of Social Security disability benefit your son or daughter might be getting is known as Childhood Disability Benefit, or CDB, and it has another name. It's also known as Disabled Adult Child, or DAC. The Disabled Adult Child name, or DAC, is the original older name that was replaced by Childhood Disability Benefit, or CDB. But many people, including many Social Security workers, still call it Disabled Adult Child. To get this benefit, your son or daughter would be getting this benefit on the earnings record of you, the parent. To get the CDB, your son or daughter would have to be an adult, at least 18 years old. They would have to have been disabled before age 22 and have at least one parent who has worked and paid Social Security taxes, and you, the parent, would now have to be either retired and getting Social Security retirement benefits, or you, the parent, would have to be disabled and getting Social Security Disability Insurance, SSDI, or the parent would have to be deceased. Then your son or your daughter could get this CDB benefit. Okay. You can apply for Social Security disability online at the link on this slide. And as I mentioned earlier, if you get Social Security disability either of those two ways, once you've been entitled to it for 2 years, you become eligible for Medicare. So, when would someone switch from SSI to Social Security disability? 2 ways, and I kind of alluded to them. One, if they worked long enough to have insured status, and as I mentioned, for younger people under age 24, that could be as little as 1.5 years of work. Or they could start out on SSI and be switched to the CDB, the Childhood Disability Benefit, if at least one parent retires, becomes disabled, or dies. So this is really important to note because your son or your daughter may start out on SSI, but later they could become eligible for Social Security disability and switch from SSI to either SSDI or CDB. Now, as I mentioned earlier, if you switch to SSDI and your SSDI benefit is low enough, you might still get a little bit of SSI and you'd keep your Medicaid, your medical assistance. But suppose you switch from SSI to SSDI and your SSDI benefit is high enough that it stops your SSI completely. Well, then your SSI and your medical assistance would stop. But there's another way you can get medical assistance. It's a program called EID. That stands for Employed Individuals with Disabilities. It's only for working people with disabilities between the ages of 18 and 64. It has pretty high income limits and much higher resource limit than SSI. Remember, the resource limit for SSI is only $2,000. For EID, it's $10,000. So in other words, although if you switch from SSI to SSDI and lose your SSI and medical assistance eligibility, if you're working, you could qualify for medical assistance through this EID program, and your medical assistance would be protected. The benefits counselor can help you with that. Now, we had a question earlier that I'm going to answer in a little bit more detail. Suppose your son or daughter starts out on SSI, then gets switched to the Childhood Disability Benefit, CDB. If the CDB benefit is low enough, your son or daughter could also still get a little bit of SSI. If the CDB benefit is high enough, that would stop the SSI, but there's a safety net that would protect the medical assistance. So your son or daughter could continue to get medical assistance even if their SSI eligibility stopped because the CDB was high enough. Okay. So, do people who get Social Security disability have access to work incentives, to safety nets? They do. I won't be going into great detail about these unless I get specific questions. But there are safety nets that let a person work 9 months at any amount and still keep their full Social Security disability and Medicare if they've already begun to receive it after the 2-year waiting period. There are work incentives that can enable a person to earn more than the usual $1,260 a month after that 9-month period and still keep the Social Security disability, the full payment. By the way, Social Security disability is an all or nothing benefit. You either get the full amount or zero. There are other work incentives that say, well, suppose you've used up that 9-month period called a trial work period, and your earnings are just too high to keep Social Security disability. But later, so your Social Security disability stops, but later you stop work or your earnings drop low enough. You can get the Social Security disability payment back just by contacting Social Security. You don't have to reapply. And there are safety nets that let you keep your Medicare generally permanently, even if you permanently work your way off Social Security disability. So you've got a variety of work incentives for Social Security disability as well as for SSI. And you can contact a benefits counselor for help understanding these rules and using the safety nets, the work incentives, once again, by either calling the Ticket to Work helpline or requesting benefits counseling from DOORS, just as you would for SSI. And wanted to give you a little bit more information about that EID, Employed Individuals with Disabilities program, a little bit more about eligibility for it. So if a person has a disability, they're working, they're not getting medical assistance, or they're going to lose it, they could enroll in the EID program to get medical assistance or keep it if they have a disability that meets Social Security's medical criteria. Well, if they're getting Social Security disability, they would meet that criterion. They have to be 18 to 64 years old, have to be working for pay. There's no minimum amount they have to earn. I've known people who were earning $50 a month who still met the work requirement. But on the high end, they could be earning quite a lot. A person whose only income is earnings from work, let's say they've worked their way off Social Security disability, could be earning well over $70,000 a year and still meet the income limit for EID. And they have to meet the limit on assets or resources, $10,000 for an unmarried individual, $15,000 for a married couple, and the same kinds of assets that don't count for SSI don't count for EID either. The home you live in, the first car, ABLE accounts, special needs trusts, burial funds, etc. So if a person uses EID to qualify for medical assistance, they have no other insurance, medical assistance will provide comprehensive coverage, just like it does for people on SSI. What if a person gets Medicare and they get medical assistance through the EID program? They can save big money. Generally, when a person gets Medicare, they have to pay for some out-of-pocket costs, monthly premiums, deductibles, co-insurance, co-pays. But if a person on Medicare also gets medical assistance, the medical assistance wipes out virtually all of the out-of-pocket costs for Medicare, and that can save a person thousands of dollars a year. As I mentioned earlier, if your son or daughter has private insurance, they can get medical assistance to supplement it. And the EID program does have a cost for most people. It's a monthly premium, but it's on a sliding scale. The maximum premium is only $55 a month, and the most common monthly premium is only $25 a month. And the benefits of getting medical assistance usually far outweigh that monthly premium. And I believe that was the last slide in the PowerPoint. So, Melissa, let's open it up for questions.
You've got some great questions. Thank you, Michael. Information there to take in and digest. Here's a question. Let's say if I charge my son $500 a month, does it count as income that I have to pay taxes on at the end of the year?
Okay, and what was the dollar amount, Melissa?
$500 a month.
$500 a month, okay. Yes, if you charge your son or daughter for room and board, whatever the amount is, that amount should be partially taxable. You'd want to confer with an attorney, an accountant, for specific advice. I'm not an accountant. I can't give tax advice. So what I'm venturing here is a non-professional opinion. But my understanding from experience is that a portion of what you collected for room and board would be taxable, but not the full amount, because you can subtract amounts that you had to pay, such as the food your child consumed, the utilities your child used, and perhaps maintenance, repairs, depreciation on your home. Next.
Okay. My brother-in-law set up a college fund for my autistic son a few years ago. He is 17. How would this affect his SSI benefits? And I'll just remind everybody, make sure you're muted. Hearing a little paper shuffling. So,
Okay.
thanks.
If a person other than the person with a disability who gets SSI, another family member, sets up a college savings plan, that will not count as a resource for the child who receives SSI. And when I say child, I mean could also be your adult child. Will not count as a resource for the person getting SSI. So it wouldn't have any impact on their SSI eligibility.
Thank you. All right. This one got answered. This one, my son is 25. He'll come off parents' medical at 26. Is it beneficial to apply for SSI for medical assistance?
Okay. Yeah, good question. Many parents take advantage of a rule that that's part of the Affordable Care Act that says that you can keep your child on your private insurance, you the parent, until your child turns 26. What happens after that? Well, at that point, if your son or your daughter is getting Medicare through Social Security Disability or Medicaid, medical assistance, through SSI or the 1619B rule or the EID program, then they could keep that insurance. And at that point, if the private insurance was out, it was out the window, they no longer received it, then the Medicare, if they received Medicare, would be primary. The medical assistance, the Medicaid, would be secondary if they had both Medicare and Medicaid. If they have only Medicaid, then Medicaid would be their sole insurance. But remember that a person who gets private insurance, either through their own employment, through parents, through spouse, can also receive Medicare and or Medicaid. So a person can have multiple forms of insurance. Okay, next.
I'm sorry, and I apologize for the barking dog in the background. All right. All right. These two seem to be related to CDB. I'll read them both. Is the CDB amount higher than that of SSI? And what is the high enough amount for SSDI?
Yeah, that's a good question. I'm going to answer the last question first. If a person receives $803 a month or more from Social Security Disability, that would terminate their SSI. Okay. Now, how much is the benefit amount going to be for CDB or for SSDI? Remember, the Social Security Disability the person with a disability gets on their own work history. The amount of either benefit is going to depend on the lifetime earnings of either the person with a disability, if it's SSDI, or the parent, if it's CDB. What Social Security does is they take the person's lifetime adult earnings, they index them for inflation, they come up with an average, and then they apply a formula to figure out how much the monthly benefit will be. The monthly benefit amount can vary greatly. I've known people who received less than $100 a month. The maximum SSDI benefit is currently over $3,000 a month, but usually somebody would have to earn a six-figure salary for a number of years to get that much, that maximum. Okay, so the amount a person gets depends on how much was paid into the system. Now, the CDB benefit that your child can get is going to be generally based on a percentage of the benefit that you, the parent, could receive. If you, the parent, are alive and you're receiving Social Security retirement or SSDI, generally your son or your daughter would be able to get a benefit that equals half of the benefit that you, the parent, receive. That does not reduce your benefit. You'll get your full benefit, but your child will be able to get a benefit in addition. And I'm oversimplifying here, but generally the amount that your child can get is going to be equal to half of your benefit. But there are exceptions. Sometimes it would be less, particularly if any other family member was getting a benefit on the record of you, the parent. Okay. Now, if you, the parent, are deceased and your son or daughter is getting the CDB benefit, they can get 75% of the benefit that you would be eligible for if you were still alive. It's not something you necessarily want to advertise to your kids that you're worth more to them dead than alive, but there you have it. Those are the rules. But the amount of either SSDI or CDB can vary greatly depending on the earnings history and whether you're getting the benefit on your own record or on a parent's.
Okay. The next question is about the Ticket to Work program.
Yes.
So there's a couple questions about that. Does the Ticket to Work program help you find a job for the trial period? Or do you have to have a job offer lined up? Also, do you receive SSDI while on the 9-month trial period? I've always had hospitalizations while on the job because of a job. My concern is testing the waters and it does not work out. And if it does not work out, how can I go back to SSDI and stop the work trial?
Okay. I'm going to answer the question about SSDI first, and then the one about the ticket to work. So forgive me for going a little bit into the weeds, that a lot more detail than was provided on the slides, because again, the focus was SSI because of the age group of your children that we're dealing with here. Generally, they'll be receiving SSI rather than Social Security disability. But a person who gets Social Security disability has 3 phases of work incentives. The first phase is called the trial work period. That is a 9-month period during which the person on Social Security disability, either SSDI or CDB, can earn any amount and still keep their full Social Security disability benefit and their Medicare if they are receiving Medicare already, if they've waited the 2 years after getting Social Security disability. So the trial work period is not necessarily 9 consecutive months. It is generally the first 9 months that you earn above a certain dollar amount. This year it's $910 a month. So if you earn $910 a month or more, you will have used up one of your 9 trial work period months. But no matter how high your earnings, it could be $10,000 a month, you'll still get your full Social Security disability benefit. If you earn less than $910 in a month, you don't use up any of your trial work period months, and you'll still keep your Social Security disability, the full benefit, and your Medicare if you're already receiving it. So that 9-month trial work period is a good opportunity to try out work and be able to earn as much as you want. What happens when you've used up your 9th and final trial work period month? At that point, Social Security puts you into the next phase of work incentives, and that's called the Extended Period of Eligibility, or EPE for short. That's 3 years, it's 36 consecutive months. It starts the very month after your trial work period ended, and it goes 36 months in a row, and you can't stop it. During that time, if your earnings are below substantial gainful activity, which, as I mentioned before, is generally $1,260 a month for a person who's not blind, it's $2,110 a month for a person who is blind. If your earnings are below that SGA level, you'll keep your Social Security disability, the full benefit. If your earnings go above that level, your Social Security disability would stop. But during the extended period of eligibility, if your benefits stop and then the next month your earnings drop below substantial gainful activity, or SGA, you can get your cash benefit back, your Social Security disability benefit back, just by calling Social Security. You don't have to reapply. Finally, after that 3-year period is over, you enter the third phase, which is usually referred to as post-EPE, after the extended period of eligibility. At that point, if your earnings are substantial gainful activity, your Social Security disability benefit will be terminated. But even then, there's a safety net that would let you get Social Security disability back in a way that's quicker and easier than reapplying if your earnings later dropped below SGA or you stopped work. And finally, as long as you're getting Social Security disability and you've been receiving it at least 2 years, you'll continue to be eligible for Medicare. But even if you work your way off Social Security disability, you can keep your Medicare permanently. So those are the Social Security disability work rules. And I apologize to those of you who were just bored to tears by that, but I know some of you had some questions about Social Security disability. And in fact, there was one that was submitted earlier. I think I've answered all those questions, but if not, please fire away. We still have a little more time.
All right, thank you.
Oh, I'm sorry, Melissa, I didn't answer the question about the Ticket to Work. So the Ticket to Work is a program that was originally designed to enable people to hire an organization to help them get and or keep employment. It hasn't necessarily worked out the way it was intended, but at this point, generally, if a person is working and they have earnings that are high enough, they could hire an agency to help them continue working at that level. The agency will be able to get payments from Social Security based on the individual having earnings high enough, and the individual can continue to get services. Okay. Now, when somebody has a ticket to work and they assign an agency to help them with employment services, if they're earning enough, they'll be temporarily exempt from medical reviews. So Social Security can't review them to see if they've medically improved. And therefore, they don't have to worry about even the remote possibility of their benefits stopping because Social Security says they're no longer disabled enough. So that's how the ticket to work operates. And I think we're ready for the next question.
Okay. This person has an adult child currently on SSI based on a lifelong chronic disability, which is managed with medication. Is a medical review conducted when you apply for SSDI? In this situation, under an application, the adult child has a chronic lifelong disabling condition, but successfully treated with medication.
The answer to that question, unfortunately, has changed recently. It used to be the case that if you got SSDI or SSI and then you applied for the other benefit, because it was assumed, well, if you qualified for one benefit, because the definition of disability is the same. But in recent years, Social Security changed the criteria, the medical criteria for disability for a variety of disabilities. And as a result, they said, well, if you are getting Social Security disability and you apply for SSI, or you're getting SSI and you apply for Social Security disability, you still have to go through a medical evaluation because the criteria for disability for a variety of disabilities changed. So unfortunately, you do have to go through a new medical evaluation.
Okay. After SSDI approval, how frequent are the medical reviews for continued eligibility?
Okay, great question. When you're first approved for SSI or Social Security disability, obviously you've gone through a medical evaluation to demonstrate that you meet Social Security's definition of disability. What happens after that with medical reviews? Social Security schedules those medical reviews according to a schedule based on how likely they think it is that your disability will improve. If they expect you're going to improve, they can schedule them anywhere from every 6 to 18 months. If they think that it's possible your disability will get better, but they're not necessarily expecting it, they're supposed to schedule them about once every 3 years. If they don't expect your disability to improve, then the medical reviews are supposed to happen once every 5 to 7 years. Now, I want to stress something. Social Security is overwhelmed. There are now about double the number of people getting disability benefits that there were 20 years ago. But there are far from double the number of Social Security workers now than there were 20 years ago. So something has to give. Oftentimes, it's the medical reviews. So the medical reviews are often much later than they're supposed to be. During the coronavirus emergency, they've suspended the medical reviews completely, temporarily. So that's one example of how Social Security being overwhelmed can actually be to your benefit, because they're not doing medical reviews now at all during the emergency, and they usually don't.
think we lost you
We're ready
there.
for the one.
Michael.
Oh, I'm sorry. Can you hear me now?
Yes, yes.
Yeah. So the medical reviews are often delayed longer than they should be, which is not bad news for the individual. It means it's one less hassle you have to deal with. And they're suspended completely, temporarily during the coronavirus emergency. And I think we're ready for the next question.
All right. This question is about mental health services that are available through Medicaid. This person has an 18-year-old and they're applying for Medicaid now. So she wants to know what mental health services would be available.
Okay. Medicaid funds a full range of mental health services, psychiatric services, therapy, prescription medications. Also, if you apply for services through the behavioral health system, you may want to go to the website for the Maryland Behavioral Health Administration. It's part of the Maryland Department of Health. You can potentially qualify for extensive behavioral health, mental health services from programs in the community. And that can, in some cases, even include residential programs and job programs. And next.
Okay. When approved for SSDI, is your spouse entitled to benefits?
When approved for SSDI, is your spouse entitled to benefits? In some cases, yes. In others, no. If your spouse is caring for a dependent child, for your dependent child who's under age 16, then they could qualify for a spouse's benefit based on having a dependent child they're caring for. They call that a child in care. If your spouse is at least 62 years old, they could qualify for a spouse's benefit. Is it 62 or 60 for the spouse's benefit? I believe it's either 60 or 62. Forgive me, not sure. If your spouse is disabled and meets Social Security's definition of disability, then your spouse could get a benefit. Actually, this one's only available if you're deceased. Your spouse could get something called a disabled widow's or widower's benefit. But if you get Social Security disability, you're still alive and you have a spouse who's living, they could get either the spouse's benefit based on having the child in care, the dependent child they're caring for, or they could get a spouse's benefit at, and forgive me, I don't remember if it's age 60 or 62 or older. Okay, next question.
All right. Where were we? This is about applying, a son applying for SSI for the first time. What kind of documentation from people who've supervised him in work type situations is helpful to strengthen that application? Supervisors' responses to questions, strengths, weaknesses. This is a son with 17 with autism, little work experience, doing some pre-ets through doors.
Okay, that's a great question. As I mentioned earlier, if your child has some work experience, in some cases that can actually help them qualify for SSI or Social Security disability, because the adult definition of disability says that you have to have a severe disability that limits your ability to work. If you have absolutely no work history, that's all guesswork on the part of the Disability Determination Services Agency. If your son or daughter has some work experience, even unpaid work experience, and their former employer, the supervisor, job coach, whomever, who had direct experience with them when they were working, can document in a letter, a brief narrative, whatever, can document how their disability affected their ability to work, how it limited their workability. That report could be very, very helpful in getting the SSI or Social Security disability approved. For example, if your son or daughter has autism, if they have interpersonal issues, interacting with supervisors, coworkers, customers, that should be documented. If they have behaviors that are not typical to the workplace that could affect their workability or their ability to interact with others in the workplace, those can be documented. If they have difficulty following instructions or perhaps changing routine, and that's a part of the job that they had some experience in, or the job training, that should certainly be documented. There's no specific form that needs to be used, but if someone, a supervisor, a coworker, even a job coach, can write up a narrative, that could be really, really helpful.
Okay, thank you. Can someone on SSDI getting Medicare also get Medicaid? If so, how?
Yes, a person on SSDI who gets Medicare may receive Medicaid in any of several ways. One way would be if they're working and they use the Employed Individuals with Disabilities, or EID program. And I'd say the majority of people who are enrolled in EID are people getting Social Security disability and Medicare. And as I mentioned kind of briefly, and it's on this slide here on the screen now, if a person gets Medicare and then they get medical assistance or Medicaid, the medical assistance can save them potentially thousands of dollars in out-of-pocket costs for Medicare. Another way would be if a person gets Social Security disability and a little bit of SSI. Along with SSI, they'd get the Medicaid. There are some other ways, a few other ways, but I think I'm going to not burden you with those at the moment.
Excellent, thank you. Okay. Is it possible for our kid to keep the SSDI 0.5 of parents' SSI without working, but also keep Medicaid/Medicare?
I'm not sure I understood the question. Can you try that one again, Melissa?
I think I'm going to ask whoever submitted that, maybe give me a little in the chat, maybe clarify that question, and we'll go to another one while we're doing that.
But we'll definitely answer that one before we sign.
Yes.
Okay.
What are the procedures to apply for the EID program?
Okay. What you can do is go to the Maryland Department of Health website. If I recall correctly, the URL is mdh.maryland.gov. Or no, I'm sorry, I think it might be health.maryland.gov. If you just Google Maryland Department of Health, you'll find it. And when you get into the home page, go to the search field and type in Employed Individuals with Disabilities. And there's an entire section of the website that provides information about how to apply and lots of other details about it. Also, you could get help from a benefits counselor, either by calling the Ticket to Work helpline or getting the Doors counselor to hire a benefits counselor to help you.
Thank you. Okay. This question goes back, it was somebody who asked a question, sort of a clarification with the mental health and Medicaid.
Yes.
The child is currently under the parent's policy with Kaiser.
Uh-huh.
So I guess the question has to do with, if you would get the Medicaid, would you complete the mental health services with Kaiser Permanente if approved, if she's approved for Medicaid?
Okay. If you have private insurance and Medicaid, also known as medical assistance, the private insurance would be primary. Any mental health services she needs would first be submitted to Kaiser. If Kaiser covered those services, but perhaps there were copays or deductibles, if the mental health provider participates in Medicaid, medical assistance, then it's possible that the medical assistance might help with the deductible or co-payments, co-insurance. But there's another possibility that some mental health services, particularly the psychiatric rehabilitation services in the community that I mentioned, might not be covered by Kaiser or any other private insurance, but would only be covered by Medicaid. In that case, the service would still be submitted to Kaiser. They would deny it because they don't cover that service, and then it would be billed to Medicaid, and Medicaid could cover it.
Okay, thank you.
Sure.
Let's see. My child will only take parents' SSDI. This is a clarification, I think,
Uh-huh.
which will be far greater than SSI. Can my child keep both Medicaid and Medicare?
Okay, I think I follow now. So I'm going to outline my understanding of the question, and then I'll answer it. If I don't understand the question correctly, then I apologize, but if you could clarify one more time, I'll try my best. So if the question is, my child is getting SSI, and if she or he becomes eligible for the childhood disability benefit, the CDB benefit, on the record of a parent, and if that benefit, that CDB benefit, is high enough to stop the SSI, can my child still keep Medicare and Medicaid? And the answer is yes. If your child has been getting the CDB, the childhood disability benefit, for at least 2 years, then they'll become eligible for Medicare after that 2-year wait. If their SSI stopped because they got too much of a CDB benefit, the CDB was high enough to stop the SSI, there is a protection that lets them keep their medical assistance even though the SSI stopped due to the CDB benefit. And again, if I didn't understand your question correctly, please go ahead and type a clarification into the chat, and I'll try again.
Okay. And I don't know that we can answer this one again with the Kaiser, the parent is asking, is it better to, I guess, trying to decide whether to stick with Kaiser or to go with the Medicaid?
Okay.
I don't know if you are able to comment on that or not.
I would say generally, if you have a choice, if your child's going to get SSI, they'll get Medicaid either way, with or without Kaiser. They're automatically eligible for Medicaid. So I think the essence of the question is, should you keep the Kaiser, keep the private insurance through Kaiser, in addition to the Medicaid? And the advantage to keeping the Kaiser is that you'll probably have a larger choice of healthcare providers. There are probably a lot more healthcare providers who will participate in Kaiser private insurance than will participate in Medicaid. So that would be the advantage of keeping the Kaiser. The disadvantage of keeping the Kaiser is that it's going to cost more, most likely. And another option would be, if you didn't want to keep paying that, you could drop the Kaiser and just keep the medical assistance, the Medicaid. However, if you were considering dropping the private insurance, the Kaiser, I would first strongly recommend that you check with all of the healthcare providers that you'd like to keep and see if they all participate in Medicaid, in medical assistance. If they don't, then that means you won't be able to keep all of those healthcare providers. You'd have to change to other providers who do participate in Medicaid. And that might be a big factor in your decision.
Okay, thank you. I think we have one more question, but before I do that and people hop off, I want to make sure that we all thank Michael very, very much for joining us this evening, and all the partners with the Transition Outreach Partnership. And I think this is a lot of information. We're going to be posting the slides, which I think you all received, and also once I figure out how to do it, because we're all learning all this new technology, a recording in 3 parts on YouTube. So we'll let you know once all those are posted. But we did have one more question. I'm in the process of applying for SSDI for myself right now. I was told I should wait until I'm approved before starting the application for my son. Do you think it's less likely to get approved if we are both applying at the same time? I hate waiting to get him help. He's under 18.
He's under 18. Okay. Let me think about this one a moment. If he's under 18 and your family income is very limited, and I'm assuming if you, the parent, are applying for SSDI, that most likely you're either not working or you're doing very limited work. If you have a spouse who's got significant earnings, that could cause your son to not be eligible for SSI. But if your family income is low enough, your son could be eligible for SSI even before he turns 18. So I think it's worth having him apply for SSI now. Now, the SSDI part and how it affects your son. If you, the parent, get approved for SSDI, then your son could be eligible at age, well, even before age 18, for a Social Security benefit we haven't talked about yet, called a child's benefit. This is a benefit that your child can get based on your work record if your child is either under age 18 or under age 19 if they're still in high school. And like the CDB benefit we talked about, the benefit amount would generally be half of the amount of your SSDI benefit. Okay. If your child receives a child's benefit, and then turns 18, but your child is disabled, then they could apply for the CDB benefit. That's the adult version of the child's benefit, but they can only get the adult benefit if they're disabled. Now, another possibility is you both apply for benefits now. You apply for SSDI, your son applies for SSI. Let's say your son gets approved for SSI, and then later, you, the parent, get approved for SSDI. At that point, your son could be switched from SSI to the CDB, the Childhood Disability Benefit. And depending on the amount of that benefit, your son could either keep a little SSI or lose all of it, but would keep Medicaid either way. So I apologize that that was kind of like a Rube Goldberg kind of explanation, but it's got a lot of moving parts to it. But the bottom line is, I would say if your family income is limited, it's worth inquiring about the possibility of your son getting SSI now and going ahead and applying. You should definitely apply for SSDI if you think you might be eligible. And if your son doesn't qualify for SSI because of your family's income, he should apply again at age 18.
Thank you. Excellent answer. Very detailed. I don't know that I can follow. You make
I'm glad you saved that one
getting
for
into
last.
weeds. Just, I mean,
I'm glad you saved that one for last.
yeah, that was a tough one. So I hope that that answered the question. Lots of great feedback, Michael. I just want to read from the chat. Thank you so much. Welcome your suggestions. Let's see, what else? Thanks for all your answers, and thanks for unpacking this very, very complicated and dense information. And I love that comment, especially because it is, and like I said, I know at the Autism Society, questions like this that we get all the time, and having the opportunity to really take a really deep dive for 3 hours on a webinar, you guys, that's pretty. Somebody said, yeah, 3 hours in the convenience of your home. So I want to just thank Michael again and thank all our partners at the top and all of you for being on tonight. I did invite you, please, if you have other topics around transition, we're going to be doing some more webinars, certainly through the summer. Please list any topics that you're interested in hearing about. And again, we'll let all of you know. Somebody else just said they spent 2 hours on hold with SSI, so this was really helpful. So thank you again, Michael. And you guys all be safe. Let us know if we can help with anything at all. Contact the Autism Society or any of our other partners. And have a good evening, you guys. Be safe.
Thank you, Melissa, and thank you, everyone, for participating.
Yeah, thank you all very much. All right, take care. Good night.
Thanks. Bye-bye.